All right, Dr. Jensen, I know you've been a chiropractor for 25 years, and we get a lot of emails. And listen to this one. I am a 37-year-old mother of 3 kids that are getting older now and need less of my attention. This caused me to see that I took care of my kids while they were growing and ignored myself. Now I have chronic lower back pain, and my father has had 2 disc surgeries. I'm worried this is my future. My father is not doing well, and even after the 2 surgeries, I'm scared and want to know, what are my options? Can you give this lady some advice?
Well, that's not an uncommon scenario. We see this a lot, and some people wonder if it's a genetic thing. In most cases, it's not. What you can do about it, some people choose to do nothing, and they just kind of take their chances and let it progress until it gets so horrible that they just can't stand it. What we prefer and what we see in our office most of the time is that people come in with these issues, and they need to be evaluated to find out what the cause of the problem is. If you just want symptom relief, there's some medical approaches to that. Painkillers, maybe some physical therapies, massage might help with just the symptoms. But I think it's really important to look at what the underlying cause is, what the contributing factors are, and that's what we specialize in. We look at the entire structure of the body, starting at the ground, looking at the feet, and working our way up. And a lot of these things, it's a combination of different stresses. It might be related to an old injury or their occupation or some structural things that maybe they were born with or developed over the years that can create that stress that can eventually lead to these chronic pain problems. But if we find the cause of the problem and address it from a functional standpoint and a structural standpoint, we get great results with those types of patients in our office.
Well, and one of the things that I saw that you do, and you talk with patients a lot, is you talk about, the person being like a building, and the building and the foundation is off just a little bit. Everything else going up is off. And so that tends to be a problem when people have discs that are wearing out. Is that not the case?
Absolutely. And the real tricky part is that the foundation, the feet, don't hurt. And so we ignore the things that don't hurt. And if the feet are just slightly asymmetrical, that asymmetry gets transmitted up through the knees, so the knees work a little bit differently, the hips work a little bit differently, and it just creates these uneven wear patterns that again turn into these chronic problems.
Okay, so to make it easy for this young lady to get a structural examination, is that what you would recommend?
Absolutely. I think that's a great place to start. Then we know what the contributing factors are.
Okay. And for our viewers, what we're going to do is we're going to offer a special offer for them, and they can either call the office at the number listed below the screen here and find out details on how to get the special offer code.
Absolutely.
Or go to the website, and again, at the bottom of the screen, the website is listed. You could click on special offers and see what the special offer code is. And I believe that there's a $75 to $160 value for that.
Absolutely. We want to make it easy for people just to find out what's going on so that they can make informed decisions about how they're going to take care of these issues.
Excellent.